I'm not a medical malpractice attorney. I don't think that, I think the medical malpractice system in this country, it does compensate a few people, very, very small percentage of people who are injured in hospitals. It certainly does not seem, in my view, to reduce medical errors generally. Doctors are very afraid of medical malpractice. And to the extent that they can, many of them practice something called defensive medicine. It's a big problem, probably costs $50 billion a year. Just the massive ordering of tests, particularly. Some of the tests, of course, can be invasive or cause opportunities for infection or radiation exposure. And I mean, there is for some, in some situations, more medicine means more opportunity for errors and complications. It's extremely expensive. It's not necessarily good medicine, the best practice, and it is a byproduct of tremendous fear of the medical malpractice system. And I think that we should evolve to a system like they have in some other countries, specialized health courts that deal with these problems faster. More people get relief. Perhaps it's not as large as the big verdicts that hit for some people, but it would be a better system. Maybe, and you know, honestly, those systems only minimally use lawyers. I don't know that lawyers are really helping that much in malpractice. And now they do perform a valid service. They do get some very badly injured people compensated. They have had a good effect on some areas of medicine. Anesthesiology, for example, due to some degree to fear of malpractice, has become a much safer field than it used to be. Well, I would say find out the experience of the person you're dealing with. Now, some doctors have great bedside manner, great reputations. You can do a little research online, but it's not that good. Ask pointed questions. Find out how many times the doctor has done the procedure, what his or her success rate is, what his or her infection rate is. They should tell you that. Be a prudent medical consumer. Go shopping. Get the second opinion or the third opinion. I would certainly say that. I would also say you really want to be sure you have adequate infection controls in a hospital, in nursing care, even in a clinical situation. This is going to sound trite. Don't let anybody touch you who hasn't freshly washed his or her hands. If the person has gloves on already, say, are you coming from the last patient, and have you washed your hands and changed your gloves? You should do that. It's a very, every one of these protocols, which are sometimes called bundles for infection control, whether it's for a central line or people on a ventilator or surgical site infection control, every one of them includes hand hygiene. It's really difficult to get staff, doctors, nurses, to wash their hands properly. To wash your hands properly takes 15 seconds on all surfaces. Now they do it for a while, but hand washing, and they have these spies who go around checking on them. They're not popular. They're sometimes called secret shoppers in hospitals. And for a while they'll do it, but basically hand washing control goes down to about, I'd say, 40% if compliance. So what you want to do, the best thing you can do, first of all, be mindful of it. Don't let them get away with it. Don't let them even put a stethoscope on you if they haven't freshly disinfected at least the bell of the stethoscope. Don't get in a wheelchair that hasn't been disinfected since the last patient. All of these things are your rights, but you have to speak up. Now, for hand washing control, the thing that works the best is to put cameras, and there are cameras everywhere in our society now. But if you want doctors and nurses to wash their hands, put cameras by those alcohol dispensers, and they'll do it. Studies show that once you do that, compliance goes up over 90% and it stays there. So, but yeah, you have to see good infection control, or 10% of people are going to come out of hospitals with infections, and that's a mess. If you have a bloodstream infection and you're septic, you're really a sick person. You don't want that. You really don't want that. And probably of the people who get infected, maybe 10% of them will die from it. So it's a massive problem. We have, you need in the hospital, in the clinic, in the doctor's office, you need a basic public health prevention orientation. And you want to see that, if you can, when you go into treatment.